prioritize them when we shall do the employment very soon. We also have challenges facing us in the ECD. The funding is somehow inadequate. I'm happy that the day I landed here, I saw a vehicle specifically assigned to the ECD, and I took the photos, sent back home. I believe we are also going to do something. So this function has been good, especially to me. You don't have a vehicle. We also have challenges with the instructional materials. I believe if the capitation will be brought, it will help us sort out that problem. We also have challenges between there is a strained relationship between the national government and our ECD teachers, the primary head teachers who are hosting us, and the ECD teachers. Primary belongs to the TSC. The ECD teachers are answerable to the county government. So kuna hiyo kuvutana kidogo kidogo, but we are ironing it out and synchronizing our efforts. And the mitigation factors is that we appeal that more funds be allocated to the ECD, more teachers to be employed. We are also, last week we introduced MILIC program. We expect to roll it fully. It is a pilot program, and in our budget that we have just read the last week, there is money which has been assigned to supply MILIC to our schools. I believe my 2 minutes are out. Daktari, asante.
Thank you so much. As he said, I was trained as a preschool teacher in Trans Nzoia Disese. So that was my very first job before I moved where you are seeing me. So when he says they molded me, that is what he means. And my CEC Education Trans Nzoia, thank you so much for being here. So now we move to county 2 minutes.
Thank you, Dr. Lee. My name is Ken Orwenjo, the Director of Public Health from CI. I'm representing the CEC Education, Dr. Tumba. I'm going to be very fast so that I don't waste the 2 minutes. Maybe a little bit on the particular opportunities that we have. Of course, availability of partners who support both ECD and then, of course, the extent to nurturing care for early childhood development so that it has that particular hybrid mix for a multi-sectoral approach basis. And then the membership with the LREB, the CEO has talked about that, and CI is a member. There's, of course, budgetary allocation in the CIDP to be able to support both ECD activities and nurturing care for early childhood development. And then, of course, also the ADP reflections are also clear on the ECD budget. But I remember there was a presentation by Meniza yesterday, which was, of course, giving a clear direction on what we really need to do when it comes to budgeting for ECD. Is not getting the budget for ECD, but looking at the various particular activities that are aligned to nurturing care for early childhood development and budgeting for them in our different various departments. Because if we do have a budget for ECD, then it would be like getting a new program on board. And that would be difficult to, of course, convince the politicians on what is needed in that. And then, of course, the partnership, of course, with the academia to be able to support, especially on M&E, and also, of course, generation of evidence that can be utilized on decisions. And then draft, of course, and review of the policies required. We've noticed from the policies that we have that, of course, there are a lot of components that we left out to be able to make this particular child thrive. So the status, CI, I'll give you a little bit of what is happening at health and also, of course, education. Health, of course, we have about 184 facilities. With 2,228 community health volunteers. Currently, to be referred to as community health promoters. So these are our key agents who, of course, pass key health messaging to the households concerning, of course, nurturing care for early childhood development, and also supporting the ECD teachers, of course, in coming up with, of course, programs that are supportive to nurturing care for early childhood development. We also had little challenges that I think are also faced in all these other counties, challenges to do with human resource for health. Of course, we're trying to bridge the gap by, of course, eliminating services that can be offered at different levels. Like, for example, the ones for nurturing care for early childhood development. Being that the child is very key for us here, we are focusing more on the child, and this particular child stays in an household. So we are strengthening the maternal and child health as a means of course, supportive to nurturing care for early childhood development. We have also issues with these socioeconomic factors, of course, that is facing also other counties. Now, a little bit on education. Public, we have about 689 ECD centers, but only 6 or 9 teachers, ECD teachers. But we know the requirements talks about 2 per center. So there's that particular deficit, part of which is, of course, the gap is trying to be filled by, of course, volunteer ECD teachers. But just like Bungoma has mentioned, I think Transoya has mentioned, we also did, of course, confirm the ECD teachers just the other week on permanent and pensionable basis. On the budgeting bit, I think I've mentioned that, but a little bit on the issue of policy. It requires, again, this multi-sectoral kind of an approach and developing of these policy briefs to support as, of course, make a case for the child who is voiceless in this case. And that will mean that we come together in partnership so that we're able to, of course, review the policies and have the advocacy briefs at hand so that when we get a quick talk with any of the politicians who make decisions, then they can be able to support nurturing care for early childhood development. What I will say closing up is then the focus really is not ECDE, because then we'll be not looking at it the way it should be looked at. Because if we look at ECD as education bit, then we are going to miss the point, because we are talked here about the child, of course, nurturing care starting from conception. So if we don't really conceive this child well, take care of the child well, so that we make the child ready for education, then, and we jump ship and try doing what? Making the ECD centers friendly and all that, then we'll be missing the point, because ideally, whom are you preparing those ECD centers for? They're these particular children. And that particular discussion was also here when you're talking about the increase in the number of care centers. Increase in the number of care centers will also translate to the increase of mujila wazes. When you get old, and when you're still young and you're taking them to ECD centers and having more of these ECD centers, these particular care centers, then when they also get to their level where they're also looking for their survival economically, then they'll pick all of you here and put you in certain homes that will be called mujila wazes. So it's now for us to be able to, it's upon us now to be able to forge forward, try as much as possible to take care of this child so that they're able to thrive. Thank you so much. That is Siaya.
Thank you so much, Siaya, for that presentation. Can you give them a round of applause? Thank you, thank you. So next is Pusia, please, 2 minutes. Please give your presentation to the secretariat in that technical tent so that we can read it. Jane was my student at Kenyatta University. It is important to recognize that. Karibu sana.
Thank you. My name is Jane Adongo from Busia County. I'm standing in for Dr. Baraza, the county director. I'm the sub-county director ECDE in one of the sub-counties, that is Teso North sub-county. About Busia County, the population of children in Busia County of age 0 to 5 of age 5 years and below, that is 127,154. The number of health facilities that we have that work closely with us are 137, both public and private facilities. About community health workers, we've been actively involved together with the 2,190 workers. Then about funding for pre-primary health as there is something that is not clear there, but there is no amount that has been allocated for funding in relation to early childhood for 2022-2023. Then we have trained community health workers on science of ECDE or care for child development. It's not well documented there. Then we have programs offered in health and nutrition for children 0 to 5 years, promotion of exclusive breastfeeding and continued breastfeeding. We also have growth and monitoring promotion, vitamin A supplementation, deworming, assessment, treatment, and rehabilitation of delayed milestones, nutrition, education and counseling, and support to caregivers of children aged 0 to 5 years. Then we have complementary feeding and counseling and support. Then there is screening and treatment of acute malnutrition. Then the immunization against early childhood diseases, promotion of free long-lasting insect-treated nets. Then we also have challenges experienced in the health sector at the county. We have few human resource for nutrition issues. Then we also have inadequate financial allocation for nutrition commodities. Mitigation measures for the challenges experienced in the healthcare services. There is need for employment of more nutrition personnel. And also there is need for the county government of Busia to allocate more money that will take care of children's nutrition. Status of pre-primary education. We have 460 pre-primary education centers in the county. About the number of pre-primary education teachers, we have 2,194, all on 986 are on permanent and pensionable terms. At least in every ECD center, we have 2 teachers on P&P, and in highly enrolled schools, we have 3. About funding for pre-primary, as we have some money there, allocation of 164,566,777. Then on promotion of teachers and the payment of the teachers, we have 137 million allocated for that. Then I'll skip that. Then on challenges, we have inadequate learning materials, inadequate infrastructure, lack of school feeding program, insufficient number of teachers in other highly enrolled schools. And in conclusion, on learning resources, particularly in my sub-county, yesterday I learned about the growing of the green vegetables and how it has scaled to the villages. In Teso North, I've involved parents in material development. in partnership with World Vision, they have also helped me. And in every school in Teso North, once or twice a term, parents come to develop materials from the locally available resources. And we are planning with Daktari to scale it up in the whole county. Thank you.
Thank you so much, Jen. One thing I've noted, you followed the template as we gave you. I appreciate. So finally, Kakamega County. After Kakamega County, we will break shortly for tea, and then we come back. Norep, you will be the next, starting with Turkana County, our host. Thank you.
Okay, thank you very much, Daktari. My name is Murambi Sam, Director in charge of ECD Kakamega County. Kakamega is a large county with 12 sub-counties and 60 wards. ECD enrollment as per now in Kakamega stands at 124,200. We have 924 public ECD centers, all found in our primary schools, and over 700 private ECD centers. I'm giving it as an approximate number because these private centers, they are born and they keep on dying at times. You may not get a very clear enrollment statistics. In Kakamega County, we are doing the following. We are constructing ECD classrooms. As per now, we have completed 324 centers. These structures comprises of 2 classrooms. We have the office for the ECD teacher in charge. And then we have a store. We have a water tank constructed in the same building. We have also a 4-door toilet structure. So it is completely a modern structure that actually accommodate what we call inclusive learning. Kakamega County is also providing capitation to all our ECD centers at a rate of 1,000 shillings per child since 2017. So it is being done 100%. We want to appreciate that. We are also providing furniture, what we call child size friendly furniture. Those are small chairs with tables. Out of 924 centers, we have issued to 612 ECD centers. So we have just a balance of about 300 ECD centers. And in this financial year, 2023-2024, we have allocated 18 million for the same. We hope to reduce that number so much. Now, we have employed all our ECD teachers 2004 on permanent and pensionable terms using the scheme of service approved by the COG. So certificate teachers are put on job group G. Diploma teachers are put on job group H. And degree or graduates are put on job group K. So we have done it to all of that. In ECD, we have also what we call standalone centers. Those are areas where we feel the ECDs are far. So we have gone deep to purchase land and construct centers where we feel the distance is far apart. So we have spent up to now 4.5 million buying land and constructing those centers. Like in this financial year, 2023-2024, we have 3 million allocated for that program. We have also trained or inducted all our ECD teachers on the CPC curriculum. So that is an achievement. Okay, we are also constructing what we call play equipment, modern play equipment. Like this year, We had 4 million allocated for it, and as I talk here, they are already being planted in those centers that we are located. I want to appreciate the partners we are also working with, like you said, who are also coming to help us train our teachers on this nurturing care program. They are trained what we call champion teachers in all sub-counties who are really mobilizing and doing advocacy. We have other friends or partners called Cheshire Disability Services Kenya. They are also doing a program that involves what we call inclusive learning in quite a number of centers in Kakamega County. We have World Vision, which are also doing what we're training our teachers in the board of management. I had not mentioned this also. Kakamega County has board of management in all our ECD centers. They are doing the same roles like the POM of primary schools. So the primary as a board, the ECD as a board, equally with the same functions. The same way all our ECD centers have what we call the head teachers, but we don't call them head teachers, we call them teachers in charge. Equally similar roles like the primary head teachers. So thank you briefly, that is Kakamega.
Give him a round of applause, please. Thank you so much. What Kakamega is doing, what got my attention is that they're paying teachers as per their grades, and I'm encouraging everybody and employ teachers in every school. Employ all of the teachers, if there are 3, if there are 4, so that everybody can benefit. Thank you so much. We are now going to break for our tea, and we should be here 10 minutes to 12. 10 minutes to 12. And as you can see, all indications are the other counties. We will start with Noreb Legion, and then we'll move to the other counties. Thank you so much, and let us break for our tea.
Araya zukulu waginto ya kuju ala kara. Tremendous progress has been made in terms of early childhood education within Turkana County. We've made progress in terms of enrollment, with the current gross enrollment rate at 166%, which is actually above the national average. Secondly is the provision of child-friendly furnitures and teaching and learning materials, which has acted as a pull factor for these learners to be able to come to school and continue enjoy learning.
Being a special county where it hosts the refugees, we bring in the refugees and trying to also give them the kind of education that they deserve. And also we have one ECD center called Kalobeye ECD Center that takes care of both the refugees and the host community. This is to make these children feel comfortable and to feel at home and gain the kind of knowledge and education that any other child needs.
As much as we have achieved a lot, we still have a very long way to go. Many of our children are still going to school under trees, makeshift structures, and traditional manyatas. Hence, we need more efficient ECD infrastructure. Due to high poverty levels, we have more children in ECD, and some of them are below 3 years coming to school for feeding, care, safety, and protection.
Turkana has experienced a myriad of challenges, the worst being hunger, malnutrition, household food insecurity, poverty, and high levels of illiteracy that have been able to be experienced. And so our intervention is a long-term commitment where we do know that an investment in education takes some time for us to be able to get the results. So our approach is to be able to give this support where we provide school meals free of charge.
And the major programs we have here, the key ones, we have the feeding program. We give them rice, we give them vegetable oil, we give them beans, and even we have innovative idea whereby we have also improved nutrition through Vigilant, supported by a partner called JICA.
Based on the data, we know that the nutrition condition of the kids in Turkana is not so good. That's why we want to improve their health condition by taking the vegetable.
We have political goodwill on implementing ECD programs, but there is need for capacity building on ECD among communities and county policymakers.
Due to devolution, we have also benefited from trained manpower. The teachers that we have employed as a county are trained for this particular job, and we are even training more and more so that we have quality education, because we believe that the education has to be revitalized from the down level.
We've been able to enhance the quality of early childhood education, and this has been majorly through teacher professional development by capacity building teachers on the competency-based curriculum.
Our county is vast, hence monitoring our progress becomes costly due to mobility challenges. Water is a very big challenge in the entire county, therefore children have no access to clean and safe water. Due to culture, many of our girls and children with